Good morning, everybody, or good afternoon, depending on where you are joining us from. We are going to get started with our webinar in about a minute. So please settle in and we'll get started, like I said, in about a minute. Okay. As other people continue to join, we'll just get started and they can join as they arrive. So welcome everybody to our webinar today, Insights from the 2024 Knowledge Translation Student Award recipients. My name is Robin Trainer. I'm a knowledge broker with the National Collaborating Center for Methods and Tools, which for anyone who's not familiar with our center, I'll give a really brief intro in a moment. And then I'm joined by three presenters who I will also introduce again in a moment. But I'm joined today by Hannah Bain, Miranda Field, and Jordan Chin. So to start, I will read our disclosure here. We are funded by the Public Health Agency of Canada, and we're affiliated with McMaster University. But the production of this presentation has been made possible then through a financial contribution from the Public Health Agency of Canada, but the views expressed here do not necessarily reflect the views of the Public Health Agency of Canada. I mentioned that we are affiliated with McMaster University, and our center is located within McMaster University. So for McMaster's land acknowledgement, I will say that McMaster recognizes and acknowledges that it is located on the traditional territories of the Mississauga and Haudenosaunee nations and within the lands protected by the Dish with One Spoon Wampum Agreement. So we'll start things off with a real brief housekeeping. I think that we're all familiar with Zoom or at least some sort of video conferencing software. But if you do have any tech issues, along with my co-presenters here today, I'm also joined by my colleague, Krishen. If you have any questions about the tech, about your connection, etc., you can throw that into the chat or you can text her specifically and she will help you out. We certainly encourage questions, and we'll have an opportunity to have a question and answer period in today's webinar. So please put your questions into the chat window if you can find that at the bottom of your screen. And then finally, we'll be asking a few polling questions throughout the webinar today. So when you see those pop up, we invite you to participate and answer some of our really brief questions. After today, if you'd like to access the things that you see, our slides and our recording will be available. Usually in a couple of weeks is when we get those up. The recording will be posted on our YouTube account, which you can see linked here, and the slides will be posted on our SlideShare account. If you follow us on social media, both LinkedIn and X, you can see we'll post there when these materials are available. So that's what to do after today. But for today, what we're going to do is I will give a really brief introduction to the National Collaborating Centers. I mentioned that I'm with the National Collaborating Center for Methods and Tools, but I'll introduce our program as a whole. And then each of my three co-presenters are going to talk about their award-winning knowledge translation project. So they'll each give a presentation about that, and then we'll have an opportunity for question and answer and some more resources. We always like to link to more resources if people are interested in learning more about any of the NCCs or about the National Collaborating Center for Methods and Tools. So with that, we'll start with a really quick polling question here. So you should see these pop up on your screen in a second. Basically, we're just asking, where are you joining from? How many people are in the room with you? Sometimes people like to, gather together and watch the webinar so they can chat about it in real time. And then we're interested in knowing whether or not you have visited the NCCMT before, and if you've used any of our resources. Polling questions like this, they're all anonymous, but they really help us to focus our products and our services, to see who we're reaching, and where we can improve. All right, so I'm seeing that we've got a nice mix of people from the West Coast, the Prairies, from Ontario and Quebec, and from the Atlantic provinces as well. Wonderful, thanks for joining. Everyone is solo today, everyone's just joining by themselves, that's great. Majority of people have visited our website before. A couple of people have not and have never used our resources, which is great because we're going to link you to some today, and hopefully you can check us out then. And some people have used our resources more than 10 times. That's great. All right, thank you so much for completing that, everybody. Okay. So, like I said, the National Collaborating Center for Methods and Tools is one of 6 national collaborating centers across Canada. So we were established after the SARS epidemic. We've been funded by the Public Health Agency of Canada since 2007. Collectively, we work to strengthen and support public health across the country. And we each have a different area of focus. So you can see this is the logo for the National Collaborating Centers as a whole, and then each of our 6 sites located across the country. So we've got one site that's focused on Indigenous health, another on infectious disease. We've got one looking at the determinants of health, environmental health, and healthy public policy. And then, of course, my center is looking at the methods and tools. So at the National Collaborating Center for Methods and Tools, our focus is really to support and scale evidence-informed decision-making in public health organizations in Canada. And so we do that by providing high-quality resources, real-world training, and practical mentorship that we say responds to that ever-evolving need and the ever-evolving needs of public health. Our vision at the NCCMT is stronger public health driven by the best available research evidence to improve health and well-being. So that's a little bit about us and our sister sites under the National Collaborating Center program. And one thing that we do as a collective is some of these collective initiatives. And one of these is our Knowledge Translation Graduate Student Award. And these awards support and recognize the efforts of Canadian public health scholars. Specifically, they recognize graduate students or recent grads who are leading high quality, innovative, and impactful knowledge translation projects in public health. So again, let me just tell you a little bit about these awards. So again, the purpose of these awards is to recognize the work of graduate students regarding knowledge translation in public health in Canada. And for anyone for whom this term is new, this is CIHR's definition of knowledge translation, that it's a dynamic and iterative process that includes synthesis, dissemination, exchange, that ethically sound application of knowledge to improve the health of Canadians. Provide more effective health services and products, and then ultimately strengthen the healthcare system. So the focus of these awards is really on the individual student's role in a project. For this year, we received over 20 applications from all across the country, from master's students, PhD students, and recent grads. And all of these applications were reviewed by a subcommittee of staff from each of the national collaborating centers, and they were scored according to the following criteria. So just so you can see what these awards are all about. So we looked at things like the relevance of the project to knowledge translation in public health. That was a big one. The creativity and innovation shown in the project, the scholarliness of the project, as well as its potential impact, and then the quality and the degree of support from the academic supervisor. So the award winners then received a certificate and a financial award that helped support their registration and their attendance at the recent Canadian Public Health Association annual conference in Halifax. So that's what the awards are all about. And that's enough from me, because it's my pleasure now then to present the real reason that you are all here today, which is to hear from the recipients of this year's Knowledge Translation Student Awards and to hear about their projects and what they're up to when it comes to knowledge translation in public health. So our three winners were Hannah Bain, a Master of Science in Epidemiology student in the School of Public Health at the University of Alberta. For her project, she'll present on her project that was called Supporting Tomorrow's Stewards, a knowledge mobilization project for climate health literacy in Alberta elementary schools. Then we also have Miranda Field, who is a CIHR Health System Impact Postdoctoral Fellow at the University of Regina and Saskatchewan Health Authority for her project, Decolonized Theory of Place. And then we have Jordan Chin, a Master of Public Health student at McMaster University for her project, The Art of Creation, an arts-based knowledge translation method to promote and advocate for a healthy start to life. All right, so then without further ado, and if you'd like to read more about these presentations or these projects as well, you can check out our website, and that link there leads to the award winners and a bio of each of them. But with that, I am going to hand it over to Hannah, who will tell us about her project. And I will give Hannah control of my screen.
Hello, everyone. Apologies. Finding the mute button once you transfer over to the request for remote sharing gets tricky. Hello. Apologies. There we go. Kanse, everyone. I am joining you today from Amiskwichi, Waskagan, which is situated in Treaty 6 territory and Métis Nation Region 4, land stewarded since time immemorial by the Nehiyah, Denisuline, Nakota Sioux, Anishinaabe, Niitsitapi, Inuit, Métis, and many others whose histories, languages, and cultures are foundational to the vibrant community that I live in. I am a white settler on this land, and I grapple with understanding my own privilege, the impact my ancestors have had in colonizing many parts of the world, including Turtle Island, and the issues left behind by these acts of cultural violence that still play out today. I am committed to learning and living the values of justice and anti-colonialism in my personal, professional, and academic life. As a climate change and public health scientist, I am mindful of our interconnected relationship with Mother Earth. We are all relations and have obligations to respect this land that has nourished and embraced us. I am grateful to the Indigenous peoples of this land who are stewards of this relationship and who I have had the privilege to learn from in my personal and professional life. We must work together to move forward in a good way, especially as we address the climate crisis and its inequitable health impacts. Kinanaskamatin awa. So hello, everyone. As I was introduced, my name is Hannah Bain, and I am a Master's of Science student in Epidemiology at the University of Alberta. My lab is called the Climate Change and Global Health Research Group, and my specific area of study is climate change and mental health. In 2022, myself and my amazing lab mates started the Climate Change and Global Health Outreach team. This team is run by the graduate students in our lab, and today I'm really excited to tell you about one of our outreach projects, which is our elementary school lesson for grades 4 to 6. But first, a little bit of background. Climate change is a major threat to public health. Acute climate hazards such as wildfires, hurricanes, heat waves, and long-term climate hazards such as droughts and changes in vector-borne disease, along with things like rising sea level, all have really wide-ranging and potentially severe and deadly impacts on health. Mental health intersects with all of these physical health risks, both acute and long-term, leading to impacts such as post-traumatic stress disorder, anxiety, and depression, as well as more generalized impacts such as eco-grief, eco-anxiety, and solastalgia. When we look to children and young people, they are more vulnerable to both the mental and physical health impacts of climate change. On the physical health side, children's developing bodies cannot cope with climate hazards nearly as effectively as adult bodies because they're much smaller. And this includes wildfire smoke and heat, which are two of the main climate hazards we see here in Edmonton. Children also spend more time outside than adults, think recess, leading to higher levels of exposure. Children also depend on adults for their safety, both during emergencies and specific hazards, as well as when it comes to long-term climate hazards. And they often cannot take the adaptation actions needed to protect themselves without the helps of the adults in their lives. Children and young people have also been identified as being more at risk for the mental health impacts of climate change. Most young people in Canada report some sort of climate-related emotional impact. These ones you see on the screen, helplessness, sadness, fear, anxiety, and powerlessness have all been identified as being felt by most Canadian young people. These health impacts are quite significant, but education proves to be one of the ways that we can give children and young people the tools they need to adapt to a changing climate, as well as be advocates for climate action, especially mitigation. And both of these have been shown to improve and protect children's well-being. Switching gears to looking at how children understand climate change. In Alberta, the facts about climate change, what it is, why it's happening, are generally understood, but general climate literacy levels remain low. And this lower literacy rate comes from a still very significant amount of misinformation and disinformation that contribute to these misconceptions about climate change and increased feelings of eco-anxiety and fatalism about the future. But there is hope. Climate change education improves and addresses these key misconceptions and offers solutions for students to implement both at personal and community levels. And even more exciting, climate change education is wanted by both students and teachers, and it is not nearly as contentious as people think, especially in Alberta. Students and teachers have expressed a desire for high-quality climate change education that uses active and engaging teaching methods, as well as teaches personally relevant and meaningful information, especially what students can do at both a personal and community level to mitigate to and adapt to the climate change. This kind of education promotes healthy coping strategies that can protect mental health when put into action and can protect physical health of students and their families. It has also been shown that when children learn about climate change and climate actions they can take, they take these learnings back to their families, and there is an increase in climate action amongst young people and their families, which is really exciting. So switching to our knowledge mobilization project, we began this project in the summer of 2022, where we were like, we want to really make some sort of lesson, some sort of engagement piece for young people. I am a Girl Guide leader and I've worked with young people for a really long time. It's something I really enjoy. And a lot of other people in my lab are researching specifically the effects of climate change on young people. So we began with a literature review of the educational psychology literature and developed a lesson that engaged students mostly in late elementary. This ended up becoming with a focus on grade 5 because it overlaps with the grade 5 science curriculum. Our team then also engaged key stakeholders throughout this creation process. Leveraging my long-standing community connections with Girl Guides of Canada, we piloted these activities with children ages 8 to 15 and solicited feedback from both the kids and their leaders, especially looking to see what age group that the activities we had in mind were best designed for. And we did end up settling on this late elementary age group. We also engaged with science outreach experts from Future Energy Systems and U School at the University of Alberta, and consulted with educators to ensure our lessons were relevant and entertaining for students. In summer 2023, after 8 months of piloting the lessons, our team worked with 2 high school student interns to conduct narrative reviews of climate education literature to further improve the elementary lessons and then lay the groundwork for our grade 7 to 12 lessons, which are upcoming. The results of this process is a 90-minute curriculum relevant lesson for grades 4 to 6 that can be adapted for large-scale community outreach events. The goals of our lessons are twofold. So one, we aim to enhance climate health literacy with a focus on connecting climate change and public health while combating both climate change misconceptions and public health misconceptions. We also work with students to co-create spaces to engage with these fears and anxieties they may have about climate change with climate change and health experts. Students learn through hands-on activities, dialogue, and worksheets. This lesson has 5 main components demonstrated on the screen here. So we begin with a know, wonder, learn chart, and these allow students to really reflect on what they know and what do they wonder about the topics of public health and of climate change, and especially what do they wonder those mean together. It also allows us to gauge an understanding of a class while we go in. We complete the what I learned at the end of the activity. This is followed by a developmentally appropriate explanation of both climate change and public health using videos from key experts in the field. We then go to a hands-on group activity that links climate change hazards that regularly impact the students, especially wildfires and heat waves, to mental and physical health impacts. So the students each get a card and they have to find the other 4 people in their group, and they get to learn all about how climate change impacts a specific organ system. We then move to this image-based explanation of climate health adaptations with the students. You can see here, there's kind of 3 circles. And so the inner circle talks about things they can do individually or with their family. The middle circle is things that they can do in their neighborhood. And the last one is things their governments can do. And we also talk about some strategies that they can implement as young people around 10 years old that actually can get their governments to make these changes. We then move into a discussion about potential career pathways in climate change and health. We talk a lot about climate change and health scientists and some people that we really look up to, but we also connect this to other interests that the students may have. So we have a whole one about climate change and health artists and climate communicators. How do people's skills and abilities really fit in? We talk a little bit about video games as a method for climate communication and health communication, and the students really love that one and really connect to that, seeing that their passions can connect with changes they may want to see in the world. We then end with free question and sharing time to address concerns, misconceptions, questions, and feelings about these mental and physical health impacts of climate change that they've now learned about. Our elementary lesson and its adaptable community counterpart have been really amazing successes. Looking at the numbers, we have taught our lessons to approximately 750 students with 2 different programs. One is U-School, which brings students from socially vulnerable communities around the Edmonton area to the University of Alberta, with the goal of making university more accessible to all students. And then Edmonton Public School Board's Community Marketplace programs, which brings researchers and experts into classrooms in schools around Edmonton. Through our community outreach events, namely Science Rendezvous, we have reached events with over 3,000 attendees total. And in 2024, we were awarded the Sustainability Leaders Award from the University of Alberta for our work. We are very proud of these numbers, but what really highlights the impact of our lessons is feedback from students. At U-School, the students journal as a main component of the program, and we feel very lucky that we often appear in these journals after the activity. Here are a few examples of student journals. We are really happy that we create a space that is fun for students, as a really key component of creating the lessons for us was making sure it was interactive and diverse, and it wasn't just us lecturing at the students, because we knew that wasn't going to be the most effective way to get information across to this age range. We also see that students are really genuinely retaining this information, including about public health, which we find is a topic they often have heard very little of and often can't explain very well prior to the lesson. We've also had some very lovely portraits drawn of us, which we appreciate. We also get many truly thoughtful questions from students that demonstrate just how much they care about these topics and how climate change and health is a lens that opens the doorway to really meaningful discussions. So some questions make the class laugh. Why can't we just send all our garbage to space? I've actually gotten that question like 3 or 4 times. They're very interested. Some are really quite technical and scientific. So how are allergies and public health and climate change related? That was a really interesting discussion. Some are really heavy. Is the earth going to die? You can see really these mental health impacts are weighing on children. And some are really serious. So if the governments know what to do, why aren't they doing it? And all of these questions demonstrate an understanding of climate change and especially of the health links and a desire for action-oriented education. They also show, as as these questions really do highlight that these topics weigh heavily on students, and creating a space where students can ask questions and engage in meaningful discussion with people who can have the expertise to answer their questions is really important. And so we strive to create a space that is very supportive of student mental health, as climate change can be a really heavy topic, and it's one that maybe doesn't often get the mental health informed support that it needs when it's being discussed. So health is a really key framework for climate change communication. And this is true broadly, not just for children, it works with adults too. And by combining public health and climate change frames, we tap into this universally held value of health. Everyone cares about health, and if you can get people to care about health, you can get them to care about climate change. Children and teachers really want this type of education, especially bringing in other ideas and concepts. And by including this climate change education with a health framing, we help to support students' mental health by having a safe place to share emotions about climate change that they may not have other spaces to share. It inspires action in children and their grown-ups with both adaptation actions and mitigation actions. It also promotes public health through climate adaptation. So some of those individual actions, put on a hat and sunscreen, drink lots of water when it's hot. Children don't often make these connections to why their grown-ups in their life are asking them to do these things. And a lot of students walk away from these lessons going, I get it. I get why my grown-ups are asking me to do that. And finally, it can combat misconceptions and disinformation that worsen eco-anxiety and fatalism about the future, and some public health ones as well. So thank you so much for listening to my presentation, and I'd be happy to take questions after my fellow presenters.
Thank you so much, Hannah. We do have a couple of minutes, so I'll open the floor now if anybody has any questions that they want to ask Hannah specifically. And then we will have more time at the end as well. But maybe while that content is fresh in our brains, if anybody has any questions they want to put into the chat, please go ahead. I'll give it a second here to see if anyone writes. All right. No worries. We will have a full session too at the end after everyone has presented. So thank you, Hannah, so much. Here are your references. Wonderful. Thank you. And then I'm going to hand this over to Miranda to talk about her project.
Thank you.
There you go, Miranda. You should have control.
Perfect. Thank you. Good morning. Good afternoon, everyone. My name is Miranda Field, and I am currently a CIHR ISPER Health System Impact Fellow with Saskatchewan Health Authority, and working alongside with the University of Regina. And what I'm going to share a little bit today has actually come from the dissertation work that I have done here at the University of Regina, working with a lot of the Indigenous community members. So I'll be sharing a little bit about that today. So before we dig in too much, I want to acknowledge the land where this research was conducted. The University of Regina is located on Treaty 4 territory, and many of the community members live and work where this research took place. I'm a settler, born and raised on Treaty 2 territory, and I only enter into this Indigenous research space because I have been welcomed into this space. If at any point I was ever asked to not engage in this research, I would respectfully step away. What we're going to talk about today is really digging in and addressing the TRC Calls to Action 22, which specifically looks at integrating Indigenous healing practices into the healthcare system. As we go throughout this, you'll see that the images that have been taken or that have been presented have been taken either by myself or by participants engaged in this research. Healing and learning are deeply interconnected. They do not occur in isolation. Yet it can be difficult to effectively communicate these needs of the patients and clients within a decolonized context. So the decolonized theory of place allows these voices to be heard and provides a structure for their needs to be met. To create a truly supportive environment for Indigenous healing and learning, we need to incorporate approaches that examine these place-based practices in a holistic way. So the decolonized theory of place provides a framework for analyzing and identifying decolonizing aspects within physical spaces and places, allowing us to view the existing work and identify current gaps in these different environments. Colonial practices have left a legacy of health disparities, which calls for different approaches. We need frameworks that recognize and respect Indigenous knowledge, history, and context. The decolonized theory of place is an attempt to bring a decolonized perspective into our understanding of health and well-being, honoring the voices and the experience of those most impacted by colonization. This research was really grounded in a blended qualitative Indigenous paradigm, which speaks to emphasizing that decolonizing lens, incorporating those Indigenous methodologies, and expanding our understanding of spatialized and place-based processes. Along with that, critical place inquiry was brought in as a support, which allows us to examine those complex interactions between physical spaces, human experiences, social contexts, and power dynamics. It also allowed the exploration of how places are shaped and shaped by the individuals and the communities. Robin, would you be able to advance the slide there?
Yeah, sorry about that. I'm not sure what happened
That's
there.
okay.
I'll just make sure. Yeah, you still have it, but I can do it. No worries.
Perfect, thank you. Places are not neutral. So approaching this research, it really came from 4 different perspectives. We took a look at this research from a mental health perspective, approaching it from a holistic lens and taking a look at mental health across the lifespan. With Indigenous peoples, it was specific to First Nations and Métis people located on Treaty 4. At the beginning of this research in 2017, there wasn't actually a written differentiation between the First Nations and the Métis peoples. And that is very much one piece of this research that if we were to do it again, would be a significant change that we would do, being able to differentiate and ensure that those very separate and very important voices are held or were heard. This research was built and expanded on the current Indigenous health research and really worked on privileging those Indigenous ways of knowing and being. Tying in the critical place inquiry piece again, it was really looking at places as more than the physical setting, and it enabled that exploration of diverse settings. The selection of the research sites were thoughtfully considered to offer a rich and multifaceted exploration of Indigenous mental health, healing, and learning. The sites were chosen based on their diversity, providing a balance of healing and learning opportunities, with the aim of comprehensively understanding the intersections of well-being. This diversity extended to the age perspectives of the participants, which included children all the way up to older adults. And this ensured a broad range of insights into how healing and learning unfolded across generations. Within this research, I strategically chose these 3 sites to encompass the full spectrum of decolonized to colonial institutional settings. This offered a maximum variation in the experiences and all of the dynamics at play. Additionally, geographical considerations played a role in the site selection, allowing me to explore the regional nuances of Indigenous well-being. Lastly, the sites were chosen based on previously established relationships, fostering trust and reciprocity, which were the foundational elements of this research approach. A comparative case study was used, and what this did is it allowed for the study of different locations. It allowed for the use of multiple data collection methods, and it really allowed all of this information to be viewed by both the similarities and differences between the cases, taking a look at the relationships between, and most importantly, situating all of this within the historical contexts. The decolonized theory of place is more than just a theoretical model. It's a visual framework that captures the interconnected relationships between healing, learning, and place. It was developed by listening to Indigenous community members and understanding their stories. The model consists of four main principles: meaning, environment, relationships, and learning. These principles help us to map out the factors that influence healing and learning, providing a comprehensive view of what it means to create a place of healing at the individual through to the community level. The beauty of this framework is that it's not just theoretical, it's practical. The decolonized theory of place provides a visual representation of the data we collected from our research sites. By mapping out the elements under each principle, we could see the interconnectedness of healing and learning. This approach offers a comparative view, allowing us to understand what contributes to positive and supportive environments for Indigenous peoples from Indigenous peoples. The decolonized theory of place has been applied across three unique settings: a school with a land-based learning program, a university-based healing and wellness lodge, and a community wellness pharmacy. And through that, it has shown consistent relevance at each site in each context. As we consider how the decolonized theory of place can be used, we find that its flexibility offers a range of potential applications. Currently, it serves as a visual model, allowing us to map specific elements within a given site. It also provides guiding questions that help in the evaluating of the environments, relationships, and learning processes. There is ongoing exploration to see if we can extend to measurable indicators, though we're cautious about over-quantifying the complexities of these experiences. Ultimately, the theory serves as a comprehensive framework that allows for practical applications and thoughtful interpretation, as we aim to ensure the adaptability without compromising the core values of decolonization and cultural relevance. The decolonized theory of place has broad applications across various stakeholders, including Indigenous communities, public health practitioners, and policymakers. Unfortunately, many organizations focus on just one aspect of the theory, such as belonging or learning opportunities, without considering the broader picture. This narrow approach can lead to gaps in creating truly supportive and holistic environments for Indigenous people. The decolonized theory of place serves as a comprehensive framework that guides planning, evaluation, and ongoing improvement in health and education settings. Each principle, meaning, environment, relationships, and learning, offer a set of guiding questions that help to ensure aspects of healing and learning are addressed. Now, by using this theory as a holistic lens, organizations can better assess their current practices, identify areas for improvement, and implement changes that promote culturally responsive care. Patients and clients could use this as a framework for advocacy or to establish or evaluate for decolonized spaces and learning opportunities. The decolonized theory of place aligns with the Truth and Reconciliation Commission's calls to action, encouraging all of us to take a more holistic approach to health and education. This framework is informed by Indigenous community members across the lifespan, making it accessible, meaningful, and interpretable to everyone, from children to adults to elders, practitioners, facilitators, and leadership. This entire research process was guided by elders who are intimately connected to the communities and the sites where this research took place. This offers a model that helps bridge communication gaps, ensuring that everyone involved in healing and learning feels seen, heard, and respected. So why does this matter? The decolonized theory of place, it provides a framework for analyzing and identifying decolonized aspects within physical spaces and places, allowing us to view the existing work and identify gaps in different environments. Interestingly, despite the age, location, and functional differences of each site, the similarities of the principles and elements are significant and notable. Differences that did occur appear to be better explained by structural and strategical differences between the sites and how much emphasis each site put on a specific principle. It's important to remember that the physical environment is just one facet of how decolonized places can improve health outcomes. This research continues to explore the processes and outcomes that can be achieved when a place-based, holistic approach to wellness is embraced. Places are not neutral, they are alive, shaping our relationships with ourselves, our families, our communities, and the world at large. Unfortunately, places built on colonial concepts tend to fragment these relationships, including connections to the more than human world, leading to further oppression and marginalization. As we move forward, the decolonized theory of place aims to challenge and change these dynamics, advocating for culturally responsive environments that honor Indigenous wisdom and ways of knowing. Places are not neutral. The decolonized theory of place has the potential to transform our approach to healing and learning from the voices of Indigenous communities. By recognizing the critical role that place plays in the lives of Indigenous peoples, we can create these environments that foster authentic healing and learning. This theory isn't just about academic inquiry. It's about having a real, positive impact on Indigenous youth, families, and communities. The connections to place are deeply rooted in culture, history, and relationships, and acknowledging this can lead to transformative health outcomes. Thank you.
Great, thank you so much, Miranda. Again, I'll give a couple moments here if anyone has a question that they'd like to ask while that's fresh in their minds. Save your questions for the end. And then we'll move on to Jordan. Jordan, I think I've given you control of the screen. It's all yours.
Thanks, Robin. Hi, everyone. Today I'm going to be talking to you about my master's thesis project on the art of creation, an arts-based knowledge translation method to promote and advocate for a healthy start to life. So before I begin, I would like to acknowledge that I'm currently working on the traditional territories of the Mississauga and Haudenosaunee nations and within the lands protected by the Dish with One Spoon Wampum Agreement. As a settler on these lands, I'm so grateful to have the opportunity to conduct my research here and also to be here to share it all with you. So non-communicable diseases represent the leading cause of death in Hamilton, Ontario, where I live, and also worldwide. And one factor that impacts non-communicable disease risk is the periconceptional environment. This is explained by the concept of the developmental origins of health and disease, or DOHAD for short. DOHAD research suggests that in the womb, developing organ systems interact with early life signals such as both parents' diet and exposure to pollution to modify growth trajectories. In turn, these modifications determine postnatal health and disease risk. Although thousands of scientists engage in DOHAD research globally, most healthcare workers, policymakers, and community members are still unaware of this concept. As such, new forms of knowledge translation are required to improve the public's uptake of these concepts. One such form is arts-based knowledge translation. These methods are especially effective because they transcend societal and cultural barriers by evoking emotion. This fosters understanding and retention in ways that traditional health messaging rarely does. Furthermore, they have been shown to strengthen community relationships, which are increasingly important given the breakdown of public trust in science due to the COVID-19 pandemic. This is also important because as DOHAD researchers, we aim to create communities that can work together to advocate for programs that ensure that everyone has a healthy start to life. As such, arts-based knowledge translation has the potential to be a powerful tool to promote health and improve public science literacy. This being said, arts-based methods haven't been previously used in the field of DOHAD. So to address this, the Art of Creation was created in partnership between the Art Gallery of Hamilton and the Sloboda Lab at McMaster University. It's an arts-based science translation program and public exhibition project that uses art to explain the importance of health before and during pregnancy to the public, policymakers, and social and healthcare providers. For the next 10 minutes or so, I'll walk you through the various parts of the Art of Creation and some of the preliminary findings from each. So the first part of the Art of Creation was art-based support groups with pregnant individuals from Hamilton, Ontario. All of our participants engaged in a workshop on DOHAD, and then a workshop in some of the basics in art making. Then they engaged in 6 art workshops throughout their pregnancies. They were led by an artist educator and me with the aim of using art making to reflect on the science that they learned and the barriers and enablers to health during pregnancy. Each time they completed a workshop, they also completed a survey on their demographics, DOHAD knowledge, and health behaviors. After they finished all of these workshops, they also completed a survey detailing their experience using art throughout the workshops. We also followed up with them for 6 months and 1 year after they completed these support groups. So we had 47 participants, all of whom had a gestational age of, sorry, there's a typo there, of at least 10 weeks. You can see their photos taken by our amazing photographer, Sophie Hogan, on the right. They ranged from 22 to 38 years old with a median age of 32. And 68% of participants identified as Caucasian, while 32% identified as members of racialized groups. In terms of schooling, 17% completed up to a high school degree, and 83% completed a college diploma or university degree, or one of those and post-degree education. This sample also represents 20 postal codes across Hamilton, and for those of you who are unfamiliar with Hamilton, there are roughly 25 postal codes in this area. So after engaging in the art-based support groups, we saw participants' understanding of DOHAD concepts had developed since they started the groups. You can see in these 2 graphs that there's a decrease in the percentage of individuals who were unsure if an individual's health during pregnancy affects their grandchildren's on the left or children's on the right risk of developing diseases like type 2 diabetes. Furthermore, there's an increase in the percentage of individuals who agree with these statements after engaging in these support groups, suggesting increased DOHAD knowledge. These workshops also appeared to have been beneficial to our participants in other ways. Firstly, it appears that art making was a component that helped participants express themselves. 81% of participants agreed that doing art during group discussions helped them talk about or understand sensitive or difficult topics. And 91% of participants found that doing art during these focus groups helped them express themselves. This isn't because our participants considered themselves to be artists or even necessarily artistic in any way. About half of them hadn't even done art since grade school. Regardless, they still created these wonderful pieces which represent their journeys throughout motherhood, the process of being pregnant, and some of the science they learned along the way. During the support groups themselves, participants discussed how art helped them open up more and take a mental break, which included creativity and play. Furthermore, participants suggested that the support groups gave them opportunities to develop a support system and destigmatize various pregnancy and motherhood-related topics. One participant said, "The workshops encouraged me to do something that I enjoy and set time aside, to just do something and have conversations and connect with other people and talk about similar experiences. I think it was really calming too. because we're all feeling the same thing, like, wow, thank God I'm not alone. And another one of our participants said, when I first signed up, I was like, yeah, I'm going to participate in a research study. But when I reflected on the last couple of weeks, I feel like I'm the one who benefited from being here. Not like from taking a break from my regular life that feels so busy, just to be here inspires me. And actually being around other moms who are pregnant, this is really like my only space to be around moms at the same stage, you know? So from there, we took these stories and we brought them into the Hamilton community through a traveling art exhibition. Not only did this exhibition feature our participants, but it also featured some artwork that talked about DOHAD science itself. We created a residency program where 7 local artists came in and connected with the Sloboda Lab scientists to learn about DOHAD and come into the lab to observe the experiments that help us understand this science. These acted as inspiration for the artists as they created a piece of artwork that shared their learning with the public. You can see a few examples here. Artworks ranged from rap to paintings to dance to sculpture to even murals on local community centers. Honestly, I wish I could spend my entire time talking about all of these pieces because they are each so thoughtful. These artworks, along with those created by the participants of our art-based support groups, were curated to develop an art exhibition, which will be moving around Hamilton to various art galleries, community centers, and libraries. So in December, we completed our first exhibition, which was at the Art Gallery of Hamilton. And here we collected data on the public's engagement with the exhibition through ethnographic notes, written reflections, the number of times QR codes were scanned for more information about each of the pieces and about DOHAD science itself, and through various interactive activities. So now I'm going to try and play this video for you. Perfect. So these activities included asking visitors to budget a set number of tokens into boxes with various statements about health, which you can see on the left, and to create a community art piece by putting balls into the cylinder that you can see on the right. Each colored ball represented a different aspect of health, a different aspect which may influence health. And preliminary analysis of the written reflections suggested that the public found the exhibition engaging, educational, and an opportunity for further reflection. For example, one of our visitors wrote, "The exhibition made me question how my environment was affecting me physically and mentally. Thank you for making me think." The learning and reflection in this exhibition was also further enhanced by our interactive activities. Another visitor said, "Kinesthetic learning is underrated, underdemonstrated, and underappreciated. I love that the questions here the questions are asked without a concrete answer as a way to make you think and feel and reflect. This was fun." Furthermore, ethnographic notes suggested that the exhibition acted as a stimulus for conversation amongst our visitors. Visitors in groups would spark discussions with each other about health and how people in their communities stay healthy. Sometimes these would even occur between strangers who were visiting the exhibition. But this being said, the main focus of these conversations and even the written reflections tended to be on the importance of motherhood. And while this is important, through the lens of DOHAD, it's important to consider the father or the non-pregnant partner and their impact on the pregnancy as well. For example, we want to consider the health of their sperm and the psychosocial support that they may provide. This exhibition also acted as a starting point for lots of workshops within the Hamilton community. The Art of Creation team has run workshops on DOHAD and arts-based knowledge translation with midwifery students at McMaster, Hamilton Public Health, and various elementary and high schools. One of the high school classes is actually in our exhibition right now. We also have some workshops planned for toddler play groups and for prenatal groups. And we hope to continue running these workshops while the exhibition moves throughout the city. So the data collected in our exhibition has helped us tailor the exhibition to the needs of the Hamilton community. For example, based on our ethnographic notes, we noticed that the majority of individuals who visited the exhibition at the Art Gallery of Hamilton were Caucasian and appeared to be of higher socioeconomic status. As such, it's important for us to ensure that this exhibition is shown in locations that are more accessible to a diverse set of the Hamilton population, such as the libraries and community centers that I had mentioned earlier. Furthermore, our ethnographic notes demonstrated that while visitors enjoyed engaging with our interactive activities, they may not have been the most accurate way to capture data on their thoughts on DOHAD. We had so many instances where data was tampered with, and it really made us rethink how we seek feedback in ways that are both accurate but also engaging to the public. And as we continue to host more exhibitions, we'd like to continue to use this iterative process to ensure the exhibition suits the needs of the Hamilton population. I'd also like to take some time to reflect on the implications of this work. Using arts-based methods to discuss high-level scientific concepts is an innovative solution that addresses current issues associated with knowledge translation, such as accessibility and inclusivity. And arts-based methods can be easily applied across various topics. My thesis project not only aims to advocate for health awareness, but also to empower pregnant individuals, their partners, and their communities to actively support healthy environments. In doing so, it not only functions at an individual level to promote healthy behaviors, but it also functions at a societal level to foster future health promotion, innovation, and to advocate for public health systems which facilitate improved health outcomes for future generations. And with that, I'd like to say thank you all for listening to my presentation. I'd also like to thank my lab mates at the Sloboda Lab for always cheering me on through my work, the Art of Creation artists for their creativity and willingness to explore the science, and the Art of Creation participants for sharing their stories and learning alongside me. Thank you.
Thank you so much, Jordan. Does anybody have any questions for Jordan? All right, then let me just lead us right into a little Q&A session here. So if anybody would like to, anybody who is attending the webinar today, if they'd like to ask any question to any of our participants, I do invite you to write it in our chat. Anything about their projects, anything about their process, we're happy to chat. And in the meantime, then, while we wait for questions to come in, I've got a couple that I thought of as you were talking. So I'm going to pose these to everybody. But maybe I'll start with Hannah, with you. There was something that you said in your presentation where you said, you're reaching out to students and you knew that it wasn't the most effective way to do it in one way, and that you had decided that you were going to do it in another way. And I just wondered if you wanted to talk a bit more about, that's such an important part of knowledge translation, right? Is understanding our audiences and how we reach those audiences. So I wondered if you wanted to talk at all about what was challenging for you in identifying your audience and reaching them and deciding how you were going to reach them.
Yeah, thank you so much for the question, Robin. So I think one thing that was really beneficial about my personal background is I've worked with kids since I was in late high school as a Girl Guide leader, and I've also had a lot of opportunities to do science outreach and communication in my undergraduate program. It was like part of one of my summer jobs was like science communication. And so when we got approached as a lab to do the initial, like when it was like, hey, would you have any interest in like trying something like this? I was super gung-ho about doing it with kids. I was like, yes, I'm so excited. And so I think it really shows the power of your own personal connections to the community that you're in, really allow you to bring your passion, like your whatever your passion is in your academic or professional career, to people. And that whatever your maybe your hobby, or maybe it's somebody that, you know, a group that you care about, is maybe the best route for you to go. Because then you know what kids, you know, I know what kids like. I know that they do not enjoy lectures, but they do really like throwing ping pong balls that represent greenhouse gases at each other. Well, okay, sometimes we're trying to put it in a bin. Sometimes it's at each other. You win some, you lose some. But knowing those kinds of like active, engaging activities just made it a little easier for me and my lab mates to really get down to like, okay, how are we going to get this across in a fun and engaging way?
Amazing. Thanks, Hannah. Jordan or Miranda, did you want to speak to in your own projects? Maybe, maybe Jordan, I'll go to you first, because of course your KT project is all art. It's arts based. And so it's anything that Hannah just said, does that resonate with you? Did you have a background in art and that's why you brought that to this project?
Yeah, I was actually just thinking that as Hannah was saying it. I have a background as an artist. I've loved art my entire life, and also as a teacher. I think similar to Hannah, I've brought all of that into my knowledge translation work, and I think that's what makes me love my research so much. And I think that's something that if someone's going into KT or even into any field really, that you should really think about something that you love and that you're passionate about.
Amazing. Thanks, Jordan. Miranda, I have a question specific for you, but it's also, again, open to anyone who wants to talk about it. Something that struck me, Miranda, when you were speaking was, again, this another part of knowledge translation that's so important. And it's that knowledge translation is, we say it is a bridge, right? It's a bridge between in health research, it can be a bridge between like the people who create knowledge and the people who use it. Research creators, research users. But it's certainly not, we try to get away from, it's not a one direction, it's a multi-directional bridge. It's a bi-directional bridge. There are many people involved, and that's the importance then of making sure that we are involving everyone in the process. And I can imagine in all of your projects that was important. Miranda, do you have anything that you could comment on when you were working on your project, and that importance then of bringing together all the different players?
No, and I think that's a great question, and I think that speaks to a lot of the similarities in our projects as well. Very often in academic research, you'll notice that people will very quickly say, okay, well, I need to publish, I need to write that academic journal article, and I need to get it out there. But when we look at knowledge mobilization, while that may be helpful to researchers, it may not always be accessible, whether it's to policymakers, whether it's to teachers, parents, kiddos, whoever it is. And that was something that I really focused on. And I think that's interesting that it's coming up that some of us have teaching backgrounds. I worked in public schools for 17 years, specifically with students with medical and mental health challenges and learning complexities. And I think part of that too was there needs to be the purpose, right? The participants need to understand, why are they sharing this information with you, right? It needs to be reciprocal, where you don't just get to take that information from them and then just, again, put it in a manuscript and hope that it does some good someday. But it very much is that back and forth piece, right? Whether it is as simple as like a 10-year-old understanding the project too, but also sitting down with a lot of the community members, the elders and the knowledge keepers. If it's not meaningful to them and to their communities, then a lot of the time we need to step back and reevaluate why we're doing that. Just because you can do something doesn't mean that you should. But at the same time too, there's so much research that has been done out there and has been very meaningful, but maybe hasn't been disseminated to the right people, or maybe hasn't been shared in a way that makes sense. And even just the opportunity to do these webinars, right? It's even a challenge for us as researchers and presenters to take years and years of work and condense it down to 15 minutes. But what it does is it really assists us in clarifying, right? What is that point? How can it support? And what do we want it to look like moving forward?
Absolutely. Thank you for those insights. I do see a question in the chat. So Susan is saying, each of these projects explores location, place or a specific population. And so she says, how transferable do you think these projects would be? She's wondering, can each of you comment on what might be needed to successfully transfer the intervention or theory you talked about into a different context? Does anyone want to take a stab at that?
I can start.
Go for it, Hannah.
So for our project, there's kind of two different components to it. So there's the age and then the Alberta focus. I'll start with the Alberta focus. I do think the concept of like a climate change and public health lesson is very applicable to honestly like anybody. Connecting these two things, as I said, like health is a universally held value. So if you can connect those, you can really connect to climate change and it works really well. I do think it's important to consider the climate context. So it's not going to be super useful to talk about droughts and wildfires and heat waves in somewhere that's experiencing flooding, for example, as one of their main climate impacts. And so it's just really important to actually understand like where I am and what are the climate impacts if you were to do something like this. But that is, as if you live somewhere, you know what that is. And also it's very easy to kind of implement. So that would definitely be a change that would have to be made. When we talk about age groups, so this one we actually have adapted. We've yet all the way up to an undergraduate audience. We've worked on a couple of different projects in a similar vein, connecting public health and climate change. So I've worked with kids as young as 3 using our adapted community outreach activity, and it does work. They do get it. You obviously have to simplify, and you have to connect it to really tangible physical things the younger you go. But it was literally, I think it was 2 weekends ago, I was talking to a little 3-year-old, and he was talking about how he had to come to the science center because it was smoky out that day and how he couldn't go play outside. And so they do understand and they do connect. As you kind of go with older groups, you can incorporate a bit more of those like hard science, like graphical understandings of climate change, linking it to really specific like facts, research methodologies. And people do find that really interesting. So in our high school lesson, that's one of the focuses, is allowing people to actually be able to interpret climate information and climate health information. So teaching students how to do that. And then when it comes to kind of adults and community members, you honestly kind of come back, if you're really doing it for a broad community audience, my favorite thing to think about is we usually, in the climate communication and science communication world, we say you're writing for about a grade 8 level if you're writing for the general public, which is not a term we love in like knowledge mobilization, public health, because what is the general public? But if that is a general kind of rule of thumb that we've taken as well. So those are just a few maybe reflections that I've had as we've adapted this for a variety of situations.
Great, thanks, Hannah. Miranda, go ahead.
In terms of the research project that I was on, initially when I was looking at environmental scans of even just place-based evaluations, there has been a lot of work done in the public health world, specifically with aging populations and looking at safe physical environments of rehabilitation hospitals or facilities for seniors, but taking a look at things outside of the OH&S lens, there wasn't a lot out there. So one of the pieces when kind of choosing the sites that I was going to work at was really trying to take a look at, is there transferability to this, right? Taking a look at a school, taking a look at a traditional healing lodge, but within a Western institution, and then taking a look at a pharmacy, so a frontline health delivery service model. And it felt very much like a gamble, where it could have been like, nope, not transferable. Here it is. Here's 6 years of my life, and we'll go from there. But I think the really beautiful part is that there really were some transferable pieces there. So for example, even though it was done specifically in Treaty 4, talking and having it reviewed right now by a few different knowledge keepers and elders within the larger prairie bodies, a lot of them are saying it really resonates with them. And in terms of knowledge mobilization, some of my work with the Saskatchewan Health Authority is taking a look at, can we utilize this at a provincial level? Is there any benefit? Is there a way to do that? And then similarly, looking outside of the health systems, looking at the educational systems too. I'm in conversations with what could this look like? How could this evolve within the school systems in our province? So I think we're at a really neat point where it's quite open-ended in terms of that transferability.
Thanks, Miranda. Jordan.
I've also been really thinking about how I would transfer all of the art of creation. I guess the whole project itself, really. And I think what has really struck me is the importance of connecting with the community members. So every time we go into a new space, we always talk to whoever works there to see what's the population like? What do they like to see? What would be best? And that's how we choose which pieces we think we should go into community centers or libraries, for example, and how it might be different depending on the space that we're in. I also just think if I were to bring this somewhere else in the world, I think using these same protocols of bringing artists into the lab, the artists really do understand the science when they come into the lab, and they are experts in their own field of translating those emotions and those messages to the public. And I think any artist, regardless of where they are, could create some beautiful pieces of art that are very specific to the population that they work with. So those are my 2 cents.
Great, thank you so much. And thank you for that question, Susan. She says, thank you, great insights into the process and importance of thoughtful transferability. I wonder on that note, I might add kind of a very broad question. But I wonder if when you came into this project, your various projects, whether or not it changed your participation in these projects, did it change your understanding of knowledge translation and what knowledge translation or knowledge mobilization, what that means?
I can say totally. So I did actually come to this project in my late undergrad. It was part of my finishing up my undergraduate degree was designing this, and then I've continued it throughout my master's. So I really did not have a great understanding of like what knowledge translation was, but it really put a name to a lot of the stuff I'd been doing as a science communicator, as somebody involved with like science conferences for kids, as a Girl Guide leader. I was like, oh, so that's what this actually is. And it really gave like a framework to that for me, and has made me realize how absolutely crucial, especially in public health research, KT is. Because if we don't have that, we're not going to be able to make as efficient and important impacts with our research. So definitely.
Great, thanks, Hannah.
Building upon what Hannah was saying there, I think that's interesting that you talked about kind of that growing awareness of like, this is what I was doing. And I think that talks a lot about the importance of language, and especially when you're in those academic worlds, some of the things that we give names and titles to don't translate to other professions. I worked in education for just under 20 years, and the language that we use there is very siloed. And then even leaving that, so moving into academia, but also moving into psychology and public health, I didn't always have the words or the language for what a lot of my skill sets were, right? A lot of the stuff that I did in schools was actually implementation science. Right. So really understanding what you're doing across those different disciplines, I think becomes really, really important, especially in knowledge translation, right? Even with the 3 of us here who are speaking today, we have different backgrounds. Not all of us came up straight through public health programs or there's that very multidisciplinary approach. So I think that just speaks to the importance of being able to talk between different disciplines, to learn the different languages, really to be able to move things forward, right? Even just use like a policy brief for an example. In some fields, that's not really a thing. It's not what that, or an executive summary, right? But knowing what those are, how to use them, and how to build that momentum and use a lot of those resources to move all of this wonderful research that's happening, to be able to move it forward and to kind of get the most out of it, I think is really important.
Yeah, I completely agree with you, Miranda, especially talking about those different languages across the different fields. That really resonates with me. I think for me, this project definitely changed what knowledge translation was for me, because to me, this is very different using an arts-based approach. I think I'm so used to seeing knowledge translation in the terms of policy briefs or writing or just a scientific journal article. But being able to come into this space and be welcomed with open arms and trying something new, and also just to see that the community will back you through the thick and thin as you try and figure this out, because they want to learn just as much as you want to share the knowledge too, was really important for me throughout my time on this project.
Right, thank you. All right, I don't see any more questions coming in. I've got one last question. And Jordan, you touched on this already in something that you said earlier. But I was wondering if everyone had a thought of what advice they would give for other students who are entering into this field of knowledge translation. So Jordan, you said, bring your passion with you. If you've got a passion, bring it. Certainly, if you've got another piece of advice you'd like to share, I welcome you to do so.
Yeah, of course. I think I'm really going to touch on that community aspect and just reaching out to other people in the community, because they really are, they're so knowledgeable about the people that they work with. And I think that they're a group that's not usually leveraged in the field. And I think that it's important that we acknowledge that and also harness that strength so we can move forward with all of our projects and sharing all of our research.
Great, thank you. Hannah or Miranda, do you have a piece of advice for other students entering this field? And by field, I mean knowledge translation in general.
I guess really honestly practice keeping it simple. I think again, that community piece very much echoing what Jordan is saying there, but practice keeping it simple, or explaining it to children, or explaining it to a partner or a friend who knows absolutely nothing about what you're doing. Because for students in particular, when you're on that academic journey, there's a lot of, well, I need to justify what I'm doing. Okay, am I doing this the right way? Does it make sense at a very, very, very high level? And many students get very good at explaining things at a high level, but may not be able to have just like a conversation about, why is it important? Right? Why should I care about what you're doing? How does it help me? How does it benefit me? And even being able to practice taking that discourse, right? If people don't think what you're doing is important, or if don't fully understand, but just having that opportunity and practicing explaining what you're doing in very, very simple terms, because I think at the end of in the knowledge translation world, it needs to make sense to other people. So have that opportunity to practice.
I absolutely want to echo what Jordan and Miranda said. It is so important to connect with people and to really know how to explain it at that level that is accessible. I think my piece of advice would be, and this is a piece we see in climate communication a lot, especially because it's perceived as a very political and contentious issue, is connect with people you have something in common with, from wherever that is. Maybe you're like, oh, I really want to do this knowledge translation project. Think about, where do you already fit in within your community? Who can you access? Who is it that you are going to be able to share with in a way that's going to be relatable? And so that's why I work with kids, as I've said a few times, right? It's because it's something that's so important to me in my work. But I think it really highlights the importance of inclusivity and diversity within knowledge translation and public health spaces, because the more types of people we have doing this work, the more communities that we can include and work together with to bring this information to everybody. And so yeah, that would be my piece of advice.
Wonderful. Thank you, all three of you. That was incredibly insightful. I really appreciate all your words of wisdom, because truly they were words of wisdom. Thank you for that. I will keep the chat open in case anyone has any other questions that come in. But for the next 5 minutes, I'll just kind of close things out here and say, what can we do next? And I know that there were a couple people who filled out the poll at the beginning who said, I don't know anything about the NCCMT, for example, and your resources. So if you'd like to learn more, please check out our website, nccmt.ca. You can connect with us on social media. You could register for another webinar. We've got those listed on our website as well. One of the things that we do at the National Collaborating Center for Methods and Tools is really based on capacity building and providing tools and resources to improve basically one's approach to evidence-informed decision-making, which includes knowledge translation in our public health audience. So what you can do is you can go online and you can complete a learning needs assessment, which helps to highlight where you might want to learn more, and then directs you to some of the resources that are on our site. So we have online learning modules where you can kind of go through the steps of evidence-informed decision-making at your own pace. We've got a video series, which is helpful when you're trying to understand certain research evidence concepts. And then we have what we call our knowledge broker office hours. So if you ever just want to chat through a problem, or you've got questions about really anything that's again related to knowledge translation, evidence-informed decision-making, etc., you can drop in to our office hours, virtual office hours, I should add, to have a conversation with one of our knowledge brokers, myself and my colleagues. Of course, if we have other students on the webinar today, I encourage you to apply for this award yourself. So if you are engaged already in a knowledge translation project related to public health, stay tuned we will run this award round again in 2025. So keep an eye on our website and again on our social media to see when that call comes out. But definitely worth applying to if it's something that is applicable to you and your work. So with that, I am going to open up one last polling question. And again, this is anonymous. The answers are anonymous. We're just asking, what was your impression? Did we meet your needs and expectations? We really do use this data as evaluation data to inform and improve our future webinars and online offerings. So if you take a minute to fill that in, it's greatly appreciated. And while that poll is being completed, I'll just go to the next slide here that has a few more links. Again, if you think of any questions after this that you'd like to reach out, please email us or come to our website. And I'm more than happy to answer those questions and to point you in the direction of more resources. And Krishan has put those in the chat. So again, thank you everybody for attending and for your participation. Thank you so much to Miranda and Hannah and Jordan. Really appreciate all of your insight today and have really enjoyed learning about your projects. It's very exciting stuff. I hope to see more of these projects as you go forward. Thank you so much and enjoy your day, everybody.